Good morning and welcome. My name is Jake Poore. I'm with Integrated Loyalty Systems, and I want to thank you for joining me so bright and early on a Monday morning. Happy New Year! We have gone through something unprecedented last year, and you've just hurdled over that invisible wall into a new year. It's Monday morning, you got your whole week ahead of you, and it's January. You've got your whole year ahead of you. Now, I know you've gone through a lot, and you're still going through a lot, but you've got to make a plan. So what's your plan? This is the time of year that I sit down and write out my goals, reconnect to my values, making sure me and my family and my employees are all connected to those. And a lot of times you can't prescribe it. It's got to grow organically. You've got to create a culture with intention. A culture by default doesn't work. So what's your plan? So this morning, I thought I'd share a little bit of how I prepare my organizations that I work with, my clients, and my own personal organization, as well as my personal self, and how I get ready for the new year. So that's the plan. I want to cover three things today. Number one, organizationally, what's your true north? What's your purpose statement? What's your why? Why do you get out of bed every morning? Why did you get out of bed this morning? Now, your purpose, if you work in healthcare, is very clear right now, right? We're in the middle of a pandemic. Lives are really in your hands right now, whether directly or indirectly. Your purpose statement is very clear. But eventually, that pandemic is going to pass, okay? Knock on wood, thank God, right? We're all going to get vaccinated. This pandemic is going to pass 6-9 months from now. What's going to be your plan? How do you reconnect to your purpose? And so I wanted to spend the next 15 or 20 minutes to talk about that. Number two, I want to talk to you about you. What's your personal brand? How do you develop yourself? How do you be intentional about the way you carry yourself, about how others see you? If we were to sell you on the marketplace, if we were to put you on a shelf, would people buy you, right? I know you've been with your organization for a little bit, maybe for a long bit. The question is, would somebody hire you? What's your personal brand and how you carry it forward? And number three, how do you take this purpose statement, this personal brand, and how do you localize it? So whether you work in the marketing department or you're in nursing or you're in the intensive care unit, the emergency department, or you're an independent retail organization in Pensacola, Florida, right? How do you localize it to your department, to your kitchen, to your sterile processing department? So we're going to talk a little bit about that. So number one, let's start out with a slide here that I created, which is, where are you headed? What is your organizational compass, your true north? We know that a compass only works if it points true north, right? And a lot of times that compass is spinning. So where is your compass right now? Clearly, it is pointing, whatever that direction is, towards COVID-19, vaccination, get employees vaccinated, get our patients vaccinated, get our residents and employees and frontline employees vaccinated. I get it. But what's your purpose statement? Okay, that's going to get us through the worst crisis in 100 years, but what's your purpose statement? And as you think about the organization, you also have to think about yourself. What's your purpose statement? Now, mine is simple, but I've been doing this for 18 years, almost 19 years, right? We elevate the human side of healthcare. I elevate the human side of healthcare. The pronoun is important. We can't just do this individually within our department, okay? You can't just do this yourself. The I is important. It gets you out of bed in the morning. You know what your reason for being is. You know why you do what you do. And collectively, you've got to share that with your team so that your team is all on the same page. And organizationally, we got to make sure that we do this as an organization. Otherwise, you've got a bunch of silos. You've got a bunch of islands. And with that silo mentality and that fiefdom and island mentality, you've got chaos because patients get a different experience in every department they go in. So you've got to make sure that, first of all, you create your organizational true north, your purpose statement, your reason for being. And we know now that majority of your employees are millennial generation. And if they don't know the why, the what doesn't matter. You've got to connect them back to why, right? Because somebody's always going to give them a better job, a better amount of pay, right? A job closer to home, more flexible hours, more benefits. The question is, what's going to keep them with you? And a lot of times we don't leave bad organizations, we leave bad leaders. So again, I'm going to constantly come back to you, and I'm talking to myself here in the mirror as well. So when we do this organizationally, you've got to get Noah's Ark together, right? You've got to get a requisite variety of 2x2 employees, 2 providers from surgery, 2 nurses from surgery, 2 employees from sterile processing, 2 transporters, 2 administrators. You've got to get a group of people together and create something intentional. You have a culture. The question is it a culture by default or is it a culture with intention? And at the end of this, we've got to be able to say this was designed by us and our patients for us and our patients. So yes, even 2 patients need to be in the room. Why? Because we always talk about them like they're in the room. Oh, we're patient-centered. We're patient first. But are we really? If they're not in the room to litmus test it. So what I love about this, and this is the time of year when you can get a group of people together, either virtually or sometimes socially distant in a conference room, invite some patients in. Be safe, be socially distant, mask up, but be intentional about what you want to walk out of that room. So in this case, this is Dignity Health, one of 5 medical groups called Disney Medical Foundation, or Mercy Medical Group was one of them. And they created a true north in their statement, which is 5 words. And it's actually the wristband that I continually wear since 2013, okay? Which is 5 words: we unite healing and human kindness. That's it. Healing, which is clinical excellence, and human kindness, which is service excellence. Well, what I love about this statement, and the reason I wear it, which reminds me of the purpose of what I do and why I do it, it's like a mathematical equation. 1 + 1 = 3. Healing plus human kindness equals peace of mind. For whom? For everybody, right? Every person, every time, through a culture of yes. Why did they create a culture of yes? Because they had a culture of no. Now that's them. That's one of 5 medical groups. That's physicians and staff that practice medicine in 32 hospitals spread over 1,000 miles and 130 clinics, called Dignity Health Medical Foundation. But my purpose of sharing that with you is it's a very powerful statement. Why would somebody want to wear it on their wristband? To remind them. Because it reminds us why we do what we do. I'm not just an MA or an RN or an RT or an MD or a DO or a front desk or a call center employee. I'm part of a team uniting healing and human kindness. Oh, it kind of fills my lungs up, right? Right? And a lot of you in faith-based organizations, you have a great true north, right? It's biblical, right? Especially Catholic organizations. We extend the healing ministry of Christ. That's awesome. And if you're a Christian, that'll get you out of bed in the morning. But how do you differentiate between all the other faith-based organizations and healthcare? So you've got to create something that's uniquely yours. We're not replacing your mission, your vision, and your values. We're creating a thread that ties them all together into a nice little bow that says, we're still extending the healing ministry of Christ through Catholic Health Initiatives or Dignity Health, but we're doing that by uniting healing and human kindness. And not just for our patients, but for each other. For each other. So now we can localize it. So what that means is it's got to be relevant and applicable to every department. So if you're a tray passer, which a lot of human resource job descriptions for people who provide food is tray passer, and it says must provide food at the bedside. Well, now we can localize uniting. So how do I, as a dietary services employee, localize healing with human kindness? I do that. Oh, there we go. I unite healing and human kindness, providing food that heals. So I'm not just passing a tray, go deep, right? I'm providing it because the purpose statement is the thing that I'm providing allows them to heal. The research shows is if you're in a hospital and you don't sleep and you don't eat, you're not going to get better. And your length of stay is going to extend, not shortened. However, if I can create a peaceful, healing, quiet environment where food that you find appetizing and you eat, you sleep well and you'll heal faster. The evidence is in. But does anybody tell that to the tray passers? No. Because number one, we don't have a purpose statement that unites us all. And number two, we haven't localized it to a department where they see it, okay? How about these lonely people down in the basement with the dishwashers, right? They call themselves the glorified dishwashing team. They're not dishwashers, right? They're cleaning surgical equipment and tools, right? How do we unite healing and human kindness? We provide healing and human kindness, providing tools that save lives. That should be on the entrance when you garb up in your sterile outfit and your booties on your feet. When I come out of the locker room, I provide tools that save lives. See, that's a purpose statement that gets me out of bed in the morning. When my spouse or my family or my friends say, what do you do at Kaiser Permanente Santa Clara? I provide tools that save lives. Well, how do you do that? Right? Now you can talk about your job tasks. One is mission driven and the other one is task driven. If you go to environmental services at Kaiser Permanente, right? They've got 120 EVS employees, right? They all have name tags that say EVS on it. And how do you unite them? Well, we provide clean environments that heal, right? So now I have something bigger than the sum of our parts. It's more than it's just task driven. So you've got to develop an organizational true north. We've got to break down these silos and these fiefdoms and get everybody literally pointing in the same direction. Where are we going as an organization? If you're CEO of the organization, it's got to start with you. If you're the chief nurse, nobody's going to do this in nursing without you. So we've got to make sure it's leader-led, but you can't orchestrate it. You can't make it an edict. You can't go to a conference or listen to a podcast like this or a LinkedIn Live like this and come back and say, we're going to unite healing and human kindness. It doesn't work like that, right? Culture is a lot like grass, right? The sod outside. Natural grass I'm talking about. It needs soil, it needs rain, it needs sunlight, and you got to cut it now and again, and you know who I'm talking about, right? Because there's weeds that get into that culture. But you can buy someone else's culture, right? You watched football yesterday? You watch your favorite football team? A lot of them were on AstroTurf. Looks good when you first lay it down, right? We bought the Disney way, the Studer Group way, the Huron way, the Cleveland Clinic way, but it's not your way, right? You've got to make it your way. We do heart, head, heart, or human business, human, or aid it. Great. But if you can take that idea and localize it and make it yours, then they have authorship. And authorship leads to ownership and mutual accountability. So my last one I wanted to give you in this short little wrap up and this little food for thought is what we did recently at Franciscan Health in Indiana. It's a wonderful organization, and they came up with one of the best true norths that I found. Together we, first of all, it's redundant, right? Why don't we just say we make lasting connections? What I love about this is the redundancy says we can't do this without all of us. Doesn't matter where you work. And if you're not taking care of a patient, you should be taking care of someone who is. We all have a role on the care team. And that's why we call each other care team members and not just staff, right? You want to change your culture? You got to change your stories. If you want to change your stories, sometimes we have to change the words that we use day to day to make those stories more intentional. Care team members. Together we make lasting connections, right? What's the outcome? What if we make lasting connections? We make lasting connections through our heart, hands, and faith. Oh, it's a faith-based organization. It's a Catholic organization, right? Together we make lasting connections. For whom? For everybody, right? So now let's talk about you. This is what we do organizationally. What I do every year, and I encourage you to do it too, go to the internet and Google this, The Brand Called You. It's an article back in 1997. I just started back at the Disney Institute, launching a new product for Disney in 96. And I was constantly thinking about how do I develop me as a better leader? And about a year later in September of 97, I think, Fast Company magazine, which is one of my favorite magazines, and no, they don't pay me for that plug. They came out with this article that Tom Peters wrote. And the article is about you as a brand. In this case, you're a box of Tide laundry detergent. How do you differentiate in a marketplace with all the different laundry detergents? I think it's a great article to read for me every year because I think of myself as I've got to be marketable. Am I a good father? Am I a good husband? Am I a good leader, entrepreneur? Am I good with my clients? How can I be better? And I sit down and I write something a little bit more intentional. You've got to make sure if it's written down, it's a commitment, it's a contract, okay? So this is how I plan my day. So read this article. Sit down and make a plan. Keep it short and keep it simple. The one thing I learned about working at Disney for 18 years is you got to keep it simple. 3 things, maybe 10 things maximum, right? 3 things at a time that you can focus on. And in this article, I think it'll give you some inspiration to think about you and how you carry yourself as a person, as a mother, a father, a spouse, okay? And the other thing I want you to think about is if our true north is really making lasting connections, how am I making lasting connections with my employees? One of the things that we did at Disney, which I thought was brilliant, and my friend Suzanne Hendry, who is at Renown Health now, the Chief Marketing and Strategy Officer, has made this even better when I gave her a copy, is we created a personal preference profile for our employees. Okay? So I sit down every year with my employees and they fill out this little survey. Or if you're a new employee, you just started with the department, it's totally voluntary, right? If you don't want to share, you don't have to share. But this says, who are you? Are you Eric Michael Poore? That's my legal name. Or do you have a nickname you'd like on your name tag? Oh, my nickname is Jake. There was 5 Michaels on the football team. It's a long story, but please call me Jake. I don't want to be another Michael, right? Jake it is. And Jake stuck, right? Where are you from, Jake? I'm from Rochester, New York, home of Genesee beer and the Buffalo Bills. And so what's your favorite football team? Buffalo Bills. Go Bills, right? Bills Mafia. What's your favorite snack, Jake? Reese's Pieces. What's your favorite soda drink? Do you drink soda? Yes, Diet Dr. Pepper. Favorite water? I like Perrier with lime. So all these, what do you like to do when you're not at work? I like to take my kids to the movies when we're not during a major pandemic, right? So if I do something special and you're my boss, you know that I like Reese's Pieces. You know that I drink Diet Dr. Pepper, which at Disney is not provided because it's a Pepsi product and not a Coca-Cola product. So you bring me a can of Diet Dr. Pepper to work, you've made my day. If you bring me Diet Dr. Pepper and some Reese's Pieces, wow. And if I do something exceptional, I stayed over the weekend and tried to get a product out the door for you, because poor planning on my part does not constitute an emergency on your part, but I stayed for you, boss. I covered for you. And you give me 4 AMC or 5 AMC movie tickets for my wife and 3 kids and me. I get to take the whole family and create an experience for my family. You're making a connection with me, right? And I'm not talking just about candies and sodas and waters and movie tickets. I'm talking about getting to know your employees personally. Treat your employees exactly how you want them to treat your patients. You're not just another COVID in the ICU number 4. You're not just another broken hip in the exam room number 10, right? Your name is Fanny B. Farrell, Mrs. John Farrell, my grandmother's name, right? You have a name, you have a history, you have a background, and a lot of times, now that we can't even see the visitors, we're talking to them on our iPhones or iPads, we've got to make a connection with their family too, right? So the more we get to know Fanny B. Farrell, and she wants to be called Mrs. John Farrell, the more we can make a connection with their family. And if and when she leaves this earth, whether it was by our hand or by God's hand, will the family still be loyal to the organization, even if the outcome is death? That's the litmus test. So if it's meant to be, my dad liked to say, it starts with me. So what are you going to do differently, leader, to make a connection with your employees? What tools and compasses are you going to help them develop so that they can unite and all point in the same direction? So ultimately, at the end of the day, they're making lasting connections with their patients because you're making lasting connections with them. So that's the food for thought. If you'd like to know more about these concepts, I just gave you lesson 1 from my book, 99 Lessons Learned from Disney to Improve the Patient Experience. We not only have a book, we've got lesson plans, and we created an online portal, which unfortunately you get 99 videos of me doing stuff like this. So good luck. God bless you. It's going to be a great year. Keep it going, and I'll see you next week, hopefully on a live version of this and not a recorded version.